and postpartum coach. So today what we are going to be talking about is the mental health in pregnancy. So first of all, what exactly I do, I'll just give a brief quick introduction. So this all started basically when I was pregnant. Irrespective of the fact that I'm a doctor, I'm a medical person, I was very much aware about the physical aspects of pregnancy. But when you experience the pregnancy yourself, then being a doctor doesn't really count. So it was that time जब मुझे actual पे realize हुआ that pregnancy is much more than just the physical aspect, because mental aspect जो है, emotional aspect जो है, वो हम लोग as a pregnant lady or maybe the families don't really understand. Or maybe I'm not saying that not everybody, but then most of us. So अगर हम देखें तो एक प्रेग्नेंट लेडी से हम क्वेश्चन करते हैं एज अ फैमिली मेंबर दैट हाउ आर यू डूइंग, आपको कैसा लग रहा है, आप अच्छे से खा रहे हो कि नहीं, आपका वेट बढ़ रहा है ठीक से नहीं, आपका बेबी ठीक है. बट वेरी लेस पीपल एक्चुअली आस्क अस दैट हाउ आर यू फीलिंग इमोशनली, आपको इमोशनली कैसा लग रहा है. इफ यू आर प्रेग्नेंट, आर यू डीलिंग विद सम सॉर्ट ऑफ maybe anxiety or maybe your own thoughts, कि आपकी थॉट्स आपको कुछ ट्रबल तो नहीं कर रही हैं. सो आई थिंक दैट्स व्हाट इज प्रिसाइजली द मेंटल एस्पेक्ट. अगर हम देखें तो वर्ल्ड हेल्थ ऑर्गेनाइजेशन भी हेल्थ को डिफाइन ऐसे करती है दैट द फिजिकल एस्पेक्ट, व्हिच मींस द बॉडी इज हेल्दी, हमारी बॉडी में हम एनर्जेटिक हैं और हमारी बॉडी हेल्दी है, हमारी बॉडी में कोई डिजीज नहीं है, दैट्स द फिजिकल एस्पेक्ट. Then comes the mental aspect, when our thoughts and emotions are healthy. Matlab, when we are energetic and thoughtful from the brain, it's another very, very important factor to our health. And the third is the social aspect. When we are taking care of our relationships, when we are healthy with respect to the relationships, that's the social aspect to it. So that's precisely how we define health. Now, coming to the very topic, which is the mental health in pregnancy. See, as a pregnant lady, pregnancy is not just the happy thing or a happy feeling. For statistically देखें, then 1 in every 5 pregnant women, she suffers from the anxiety or some of the mental condition at some point during her pregnancy or the postpartum period, which is almost 20% of all the pregnant ladies. So which is quite a high percentage. अब हम देखते हैं that what are exactly the causes. अगर हम mental health की बात करें तो ऐसे क्या causes होते हैं जो mental health को disrupt कर सकते हैं when the lady is pregnant. So there are a lot of causes. Like one of them is that if a lady has already been going through some phase which is depressive, anxiety, panic attacks or any other mental health ailment. तो ऐसी प्रेगनेंसी में और ज्यादा चांसेस होते हैं that that lady can actually get the medical ailment or the mental health problems. The second thing which is very, very common is unplanned pregnancy. जब प्रेगनेंसी बहुत अनप्लान तरीके से आती है, when the husband and the wife, they are not ready to conceive a child, but the lady gets pregnant and because of any reason she decides to continue the pregnancy, तो भी बहुत बार ऐसी प्रेगनेंसी में मेंटल हेल्थ के चैलेंजेस हो सकते हैं. Then coming to another very important thing is the lack of support. I always tell my clients that once you're pregnant, the most important contributory factor is your support person. It's really important. So social support is very important. And who can actually be your support person? That can be your partner, your husband, your mother, your mother-in-law, your sister, your friend. So you can choose any support person you want. So what is the importance of support person here? Because during the pregnancy, lady go through a lot of emotional challenges, जो कि हार्मोन की वजह से भी होते हैं. हमारे हार्मोन्स जो कि प्रेगनेंसी में बहुत ऊपर नीचे हो सकते हैं. The baby is growing, your body is changing at every point. Your body is making all these beautiful changes for the baby who has to come. So इसकी वजह से emotional changes, हमारी thought process के changes आना, they are very, very obvious. But हमें क्या करना है? हमें उन changes को adapt करना है. And इसके लिए हमें कौन सबसे ज़्यादा help कर सकता है? The support person. So one of the very important cause of having these mental challenges is when a lady doesn't have a support person by her side. There are many other reasons to it. Supposedly, when you have a young child already and then you have your second pregnancy going on, then again, it becomes difficult for a mother who's like just to balance both the babies together. So there are precisely, these are the few changes. And again, our dietary things like smoking, alcohol consumption, and if you're taking an unhealthy diet, this also can contribute to your mental health challenges or the mental health ailments. राइट. अब हम बात करेंगे कि अगर सपोजिटली मेंटल हेल्थ का कोई फैक्टर ड्यूरिंग द प्रेगनेंसी इफ लेडी इज फेसिंग, तो इससे बच्चे की हेल्थ को या मदर की हेल्थ को क्या फर्क पड़ सकता है. So first of all, if as a mother, as a pregnant lady, if you are not healthy in your thoughts, then of course you would not be able to enjoy your pregnancy. And I feel pregnancy is such a beautiful phase. It is very, very important for a mother to enjoy this beautiful phase 100%. अगर थोड़े बहुत challenges आ रहे हैं, then just seek some support, talk out, but then just try and enjoy it. So सबसे पहले ये प्रॉब्लम हो सकती है कि आप अपनी प्रेगनेंसी को एंजॉय नहीं कर पाएंगे. सेकेंड चीज जो आप फेस कर सकते हैं, दैट ब्लड प्रेशर because of the stress, because of the medical conditions like mental health conditions like anxiety, panic attack. There can be obsessive compulsive disorder also. I have personally seen a lot of people going through the conditions such as they get phobia because of to certain things, like so that you can have a phobia because of water also. You can have phobia because of eating any specific food. Also the eating disorders, kabhi kabhi pregnancy mein bahut zyada bhook lagne lagti hai. So there are certain eating disorders like bulimia. So we see a lot of people who have the mental health problems, they tend to face such challenges, such conditions, which is bulimia or anorexia. So these are all the medical health conditions जो कि contribute करती हैं if the lady is mentally not healthy during her pregnancy. और क्या challenges हो सकते हैं? You may face challenges like low birth weight babies. You may have the early labor. So जब labor हमारी एक particular phase, we always call it as a term period, which is after 37-38 weeks. अगर labor उससे पहले हो जाती है, that's we call as a preterm labor. इसमें obviously the baby might have the baby who's born can have the low birth weight, which is again has been seen that it is linked because mother has been suffering for some mental health challenges. और हमने बहुत ज्यादा केसेस में ऐसा भी देखा गया है that if a lady has been going through the depressive changes or mental health conditions during her pregnancy, the chances of postpartum depression are very, very high. So what exactly is the postpartum depression? So this is again a mental condition. This is again a condition which develop after the pregnancy. And इसमें देखा गया है that the lady has a lot of challenges in terms of her mental health, that she has a lot of mood swings, mood disorders, eating disorders can also be there. She may have anxiety, she may have panic attacks, she may also get into a condition which is known as psychosis. And also there can be some suicidal tendencies also. So almost if we see a patient who has a postpartum depression, so when we trace the history, so बहुत बार देखा गया है that during the pregnancy only the lady has had the antepartum depression, which has actually led to this very condition which is known as the postpartum depression. So during the pregnancy हमें बहुत ध्यान रखना है कि अगर हम ऐसा कोई भी challenge या कोई भी health problem face कर रहे हैं, so we have to bring this to our healthcare provider. We cannot just keep it to ourselves because this is very, very common. जैसे एक बुखार हमें जब होता है तो हम डॉक्टर के पास जाते हैं, वैसे ही अगर हम मेंटली अपनी कुछ एलिमेंट या कुछ थॉट प्रोसेस या इमोशनली हम कुछ इम्बैलेंस सफर कर रहे हैं, then it's very important to reach out to your healthcare provider. Talk to your gynecologist, your obstetrician, talk to your family members, talk to your husband about it. Whoever is the support person, आप बात कीजिए, because talking therapy is actually another way how we treat it. But then, as I always say, that prevention is better than cure. So it's very, very important if you talk it while you're facing it, so that आप उसी समय उस problem को देखें, उसको sort out करें during your pregnancy, so that you can enjoy this phase, you can enjoy after your baby is with you, you can enjoy your postpartum and your mothering journey. So now we have spoken about that what exactly are the challenges and what are the complications that can happen. अब हम बात करेंगे कि हम इसको prevent कैसे कर सकते हैं. As I've already mentioned that the talking therapy. So talking therapy is one thing that once you talk, once you acknowledge that you're going through all these things, it becomes very easy to adapt and to treat them further. So talking therapy is one thing. Second, we usually don't give medications until it's very, very important. We try to and do the counseling sessions with the lady, with the pregnant mother, the pregnant female. We talk her and we trace her history. There is a proper questionnaire by the Society of Psychiatry where we try and seek out the proper history, we try and seek out the proper questionnaire about it, and then we see if the lady genuinely needs any medical treatment or she can just be counseled and the things can be taken care of right there and then. और हम कैसे prevent कर सकते हैं? Sleeping patterns. So, there have been a lot of conditions. I think almost 80% of our problems arise because of the poor sleep patterns. In pregnancy, it's very, very important to take care of your sleep and to have 7 to 9 hours of sleep. That is very, very important. We all know that during the second trimester, when the baby grows, the belly grows, it becomes difficult for a lady to sleep. वो uninterrupted sleep थोड़ी मुश्किल हो जाती है. उसके लिए हम अच्छे sleeping pillows use कर सकते हैं. हम एक sleep hygiene follow कर सकते हैं. Avoid using lot of screens before going to bed. Try and do a bit of exercise while you're going to bed. Try and have a warm glass of milk like before you are dozing off, so that it becomes easy and you can get sleep easily and you can get to have that 7 to 9 hours of uninterrupted sleep. Now, eating habits. Again, our eating habits contribute to a large scale to our stress. कोशिश कीजिए कि आप बाहर का ज्यादा जंक फूड नहीं खाएं. आई नो देयर लॉट ऑफ क्रेविंग्स व्हिच हैपन ड्यूरिंग प्रेगनेंसी, बट इन क्रेविंग्स को ध्यान में रखना बहुत जरूरी है. सॉल्ट एंड शुगर का मॉडरेशन होना बहुत जरूरी है, because if you're taking too much of sugar, you can have GDM, which is gestational diabetes mellitus. And if you're taking a lot of salt intake, then again you can have high BP, then leading to the other contributory factors like preeclampsia and eclampsia. So there are a lot of clinical conditions, lot of complications जो कि pregnancy के दौरान हो सकती हैं और जो कि बहुत easily avoid भी हो सकती हैं if you take care of your diet. So please take care of your diet and try and have the balanced diet. I always say that home cooked meal is always the best thing you can have. But हाँ, अगर आप moderation में थोड़ा बहुत बाहर का खा रहे हैं तो आप खा सकते हैं, but बहुत ध्यान रखने की जरूरत है. And again, coming to another thing, again, the eating habits, drinking habits. You have to drink water. You have to take a lot of fluids, because if you're taking a proper amount of water, then जो baby आपका हमारा जो amniotic fluid है जिसमें baby हमारा float करता है, it is very important to take care of that. बहुत सारी conditions amniotic fluid पे भी based होती हैं, जिसके लिए हमें अपने hydration का ख्याल रखना बहुत जरूरी होता है. So these are few things if they are taken care of during pregnancy, and in fact before, in case we are planning our pregnancy, तभी से हम बहुत cautious रहे इन चीजों के लिए, तो हम बहुत सारी चीजें avoid कर सकते हैं. Now coming to the proper treatment part, if there is some lady who is going through depressive symptoms, panic attacks or anxiety during her pregnancy, you have to reach to your healthcare provider. अपने आप से कोई medication नहीं लेनी है. Never self-medicate yourself while you're pregnant. Don't take even the normal pills, I would say avoid it. Ask your healthcare provider, then only consume, even if it's a very small tablet that you've been consuming daily. Because बहुत सारी दवाइयाँ pregnancy में आपके बच्चे को और आपकी भी health को नुकसान पहुंचा सकती हैं. So coming to the medical treatment, there is always the risk-benefit ratio. We have to, consult a psychiatrist. And along with the gynae and the psychiatrist, they take a call together if the lady needs a proper medical treatment, if the lady needs to be on some medication. Otherwise, we normally try and take the talking therapy or the counseling session, or we call it the CBT, that's called the cognitive behavioral therapy, to take care of all the mental health conditions which are associated with pregnancy. Most of the drugs are not safe. The anti-psychiatric medications, which we call it, they are not safe. But there are some SSRIs which are relatively safe that has to be taken if a lady is going through the antepartum depression or the postpartum depression, which has to be taken after your healthcare provider is mentioning down, considering your history, your clinical condition. So it's very, very important कि अगर आप दवाई भी ले रहे हैं तो वो एक proper counseling और guidance की तरफ से आती है. So this was all about the mental health and pregnancy. हम बहुत सारी चीजें अपनी pregnancy के दौरान कर सकते हैं. We can just exercise, we can keep ourselves active, And exercise also, it has been seen the lady who is exercising well, who is staying active, she also tend to develop the depressive or the mental health condition. The chances would be very very less. So अगर हम अपने आप को एक्टिव रखते हैं, अगर हम अपने हेल्थ का, अपने ईटिंग हैबिट्स का ध्यान रखते हैं, अपने स्लीपिंग हैबिट्स का ध्यान रखते हैं, एंड वी आर emotionally healthy, our thoughts are healthy, we have a support person with us, we are taking care of the baby together as a family, it is very very the ride, this pregnancy journey can be really smooth and the beautiful phase for a mother. So this was precisely the session, and I just want to take the questions now. So I have a question here that how can my mental health affect my baby's growth during pregnancy? So I think I've already covered most part of it. So अगर आप mentally healthy नहीं हैं, तो आप अच्छे से खा नहीं पाएंगे, पी नहीं पाएंगे, आपका इमोशंस अच्छे से नहीं होगा, एंड इवन देयर बीन लॉट ऑफ कंडीशंस लाइक इवन द वॉमिटिंग एंड नॉजिया जो होता है, अगर आप स्ट्रेस्ड हैं तो वो भी ज्यादा बढ़ जाता है, तो आपकी डाइट पे बहुत ज्यादा असर पड़ेगा, एंड आपकी बेबी की ग्रोथ पे भी असर पड़ेगा, एंड फर्दर आपका डिलीवरी, like baby can have the low birth weight, you have a chances of getting the high BP, so जिसकी वजह से eclampsia, pre-eclampsia ये conditions भी आपकी आ सकती हैं, which are the complications again. So that's how it's going to affect you and your baby. And how to deal with it, I've already discussed. Exercise, stay active, and take your diet in moderation, take the balanced diet, talk to your partner, talk to your baby in the womb. It's a beautiful exercise. We call it womb talk. So आप अपने बच्चे से बात कीजिए, आप जो भी thoughts आपके दिमाग में आ रही हैं, talk to your baby. It has been seen, the females who talk to the babies in the womb tend to have a baby who is intellectually and emotionally very very smart. बच्चे का दिमाग ऑलमोस्ट 1-2 महीने में ही बनना शुरू हो जाता है, तब तक मोस्ट ऑफ द केसेस में पता भी नहीं होता है दैट वी आर प्रेग्नेंट. सो अगर आप अपने बच्चे से बात कर रहे हैं, आप उसके ब्रेन फॉर्मेशन को स्टिमुलेट कर रहे हैं इन अ वेरी वेरी हेल्दी वे. सो इफ यू आर टॉकिंग टू योर बेबी, इफ यू डूइंग अ वूम टॉक रेगुलरली, again your stress levels would be reduced to a great extent. So this is what you can do. Okay, the second question here is, are mood swings normal during pregnancy, and how can I manage them with a healthy diet? Okay, yes, mood swings are very very normal. आप ऐसा मत सोचिए that मुझे mood swings हो रहे हैं, so इसका मतलब मुझे depression हो रहा है, ऐसा नहीं है. But in case you feel आपके mood swings आपकी daily activities को properly नहीं करने दे रहे हैं, आप अपना daily routine properly follow नहीं कर पा रहे हो, then it is the time that you need to talk to your healthcare provider, because then yes, it is again a red flag when you have to be very very careful. And you can manage with a healthy diet. Again, balanced diet is very important. आप जो भी खा रहे हैं सोच समझ के खाइए, हेल्दी डाइट लीजिए, बच्चे के ग्रोथ के लिए, एंड आपकी बॉडी के ऑर्गन्स भी बच्चे की ग्रोथ के लिए काम कर रही हैं. सो इट्स वेरी वेरी इंपॉर्टेंट दैट आपका कैलोरी रिक्वायरमेंट, आपका प्रोटीन इनटेक, आपका विटामिन एंड मिनरल इनटेक जो है वो बहुत बहुत हेल्दी हो. एंड ऑफ कोर्स द वाटर इनटेक इज वेरी इंपॉर्टेंट. एंड इसमें मैं एक और चीज बोलना चाहूंगी दैट whenever if you're pregnant and you eating the food, make sure that अगर आप अपना कुछ भी खा रहे हैं, आप खाने को अपने सामने रखिए, and just bless your food. आप this is a beautiful concept. जब हम बच्चे थे तो हम प्रे करते थे स्कूल में, लंच से पहले we used to pray. So what we were doing, we were passing on to the positive energy in the form of prayers to our food. So this is again a very very beautiful and a holistic concept कि आप कुछ भी खा रहे हैं, आप उसको देखिए, आप उसको bless कीजिए, आप pray कीजिए that whatever I'm eating contributes to my health, like my good health and my baby's good health. So again, it is a very very beautiful concept that you can follow. Okay, we have another question. Will listening to music and also making my baby listen to music during pregnancy help improve the mental health and growth of the baby? Yes, it's a beautiful question, I would say. Yes, music is a therapy when it comes to your stress and when it comes to emotions. Yes, listen to the music, listen to the music, and talk to your baby while you're listening to the music. So there are a lot of stories, there are a lot of scientific evidence which say that the mothers who listen to music during their pregnancy tend to develop a baby who is really healthy emotionally and who is in fact inclined towards music. So yes, music can go a long way in reducing your stress levels during the pregnancy. Coming to another point, I would want to add that affirmations and journaling, again, it is a beautiful concept which you can follow during your pregnancy. Make a journal, make a copy, take a pen and a pencil. always get up and then just write it in your diary that I am grateful for this pregnancy. Just write that I am happy. My life is beautiful. My pregnancy is healthy. I am growing a healthy baby and I'm taking care of my diet. Just whatever you're grateful for, just write all the beautiful things or the positive things that you are facing, that you're feeling. अगेन जो अगर आप एक दो नेगेटिव थॉट भी अगर आप कभी फील कर रहे होंगे, सो ये ब्यूटीफुल पॉजिटिव आप जब एफर्मेशंस लिखेंगे तो वो भी आपकी जो है आपका थॉट प्रोसेस चेंज करेगा एंड आपके स्ट्रेस लेवल को राइट एट द मोमेंट डिक्रीज कर देगा. सो अगेन इट इज अ beautiful therapy, I think. Music therapy, affirmations, and journaling. So this was all about it. And I am Dr. Surabhi. And you can follow me on The Doctor Who Coaches on Instagram. The Doctor Who Coaches. So I have videos here. I coach all the pregnant and postpartum ladies during their pregnancy journey. If you want to reach out to me, you can do it right away. So that was all about it. Thank you for everybody who has joined in. Thank you for giving your time here. Hope you have a good day, good afternoon, and just stay blessed, stay happy.